Hi, I'm Ethan Levy. I'm a first-year student studying biomedical and electrical engineering at Johns Hopkins University, and I developed an accuracy test for coronary artery stents with sensors for monitoring restenosis. So, what is the number one cause of death worldwide? Well, with almost 18 million deaths every year, heart disease causes almost one out of every three deaths. The most common form is known as coronary artery disease, which is the buildup of plaque in the coronary artery preventing blood from reaching the heart muscle. And this can lead to heart attacks. So, coronary artery disease has two common treatments. If the patient has a medium to high amount of occlusion, and a catheter is brought to the site and expanded and place a stent, hold open the artery and allow blood to flow. However, if there's too much plaque, the catheter cannot be put through. And so, coronary artery bypass graft surgery is done, which is a highly invasive surgery where an artery is brought in to bypass the site of occlusion and bring blood to the rest of the heart. Between these two, doctors often prefer placing a stent because it's much quicker and not as invasive on the patient. However, these stents do have a problem, mainly restenosis, which happens in about 10% of patients. Restenosis is the return of plaque onto the stent, and in-stent restenosis in a recent paper by the American Heart Association was called a clinical challenge the cardiologists are still dealing with. So, smart stents were developed to help fix this problem. Smart stents are sensors with a pressure sensor that can measure the pressure inside the coronary artery and notify the doctor and patient if they should seek treatment. However, there's one main problem with this, being that there's only one sensor on the stent, as you can see in the top right. Because there is only one sensor, if something happens to the sensor, then there will be a problem with the accuracy of the device. This is especially a problem when the stent is prepared for usage in the crimping process. In the crimping process, the stent undergoes over 100 newtons of force to squeeze the stent onto the catheter to be put inside the body. During crimping, the sensor inside the stent can be broken or damaged, and that can affect how accurate the readings are from this device. So this study was set to develop a test for the accuracy of smart stents because there's no current test to see how accurate this device is. It is also set out to develop a novel method of measuring in-stent restenosis, not just measuring the pressure inside the artery, but also calculating the amount of plaque and investigating the effects of sensor redundancy. So how can adding more sensors affect the accuracy? To do this, I modeled my accuracy test after Clark's error good analysis, which is the gold standard accuracy test for blood glucose monitors. In this test, there is a reference blood glucose monitor that is expensive and highly validated in the x-axis. On the y-axis, there is the commercial device, and the closer to the 45-degree angle, the more accurate the device is. This is near the A zone and goes all the way until the E zone, which is a completely inaccurate device. With this, I developed the adjusted Clark error good analysis for smart stents with the same A through E zoning, including a D zone, where there's a life-threatening coronary blockage, but the smart stent is reporting otherwise. Then, I developed a method for measuring in-stent restenosis by using Fuseli's law, which is an equation to find the flow rate based off the pressure difference and the radius. That's how I calculate the radius of the coronary artery, and with that, could calculate how much plaque is present in the patient. This was tested stent model where there were these highly accurate, expensive pressure gauges on top, and inside the stent were nanosensors modeled after smart stents. So what I found is that as the amount of plaque builds up, as you can see on the x-axis, the accuracy of the device goes down. So it's getting farther and farther away from the 45-degree angle line because the buildup of plaque is interfering with proper measurement of the pressure in the artery. I also found that, as you can see here, the 1 nanosensor in red is farther away from the 45-degree angle line than the green, which is 4 nanosensors, indicating that there might be an increase in accuracy from an increase in sensors. To verify this, I used statistical analysis to see if there was a significant difference and found that among the smart stents, there was a significant difference in the amount of occlusion predicted, specifically between the 1, so that's the control based off the current model, versus the 4 sensors model. The data suggests that increasing the number of sensors tends to increase the accuracy of this device. So what this means is that before SmartSense can be put in patients, the accuracy must be assessed to ensure that proper readings are given to the patient and doctor. And this can be tested with the modified error grid analysis I developed. Future SmartSense should consider adding more sensors to increase the accuracy and protect against problems during the crimping process. And future SmartSense should consider the restenosis measurement method, and this could also be tested in animal models in the future. I'd like to thank the conference, IECBES, for giving me the opportunity to present my research, and I'd like to thank all my mentors and friends for all their support. Here are my references. So at the end of the day, almost 5 million stents are implanted every year. And these stents, especially smart stents, have many problems associated with them. But the accuracy test I developed can help ensure that patients and doctors are receiving accurate data and help save patient lives.